Good morning. Welcome to the Cowlitz County Board of Health meeting. We're going to start this right at 10 o'clock. Thank you for coming. Thank you for spending your time. Everybody's here except for Commissioner Dahl, who is out. We'll go through this, try and go quickly. First, review the minutes. Anybody have any questions or comments on the minutes? Everybody got them? I'd entertain a motion to accept the minutes from May 27th.
So moved. I move approval of the minutes.
Motion on the floor to approve the minutes. All in favor, say aye.
Aye.
Aye. Any opposed? And is Carol here? There's Carol. Hi, Carol. Thank you for your time. I'm sorry. I know you've gone over this many times, but we just want to touch on one slide of the opioid settlement. You have that?
Thank you.
Thank you very much. I just have quick questions. So, most of you know the Washington State has entered into some lawsuits with several manufacturers and providers. Anyways, it ended up into a bunch of money coming to the county in the form of lawsuits. And you can see it up here. We have $2.7 million. And I just wanted to clarify a little bit with that, Carol. Is that coming or is it in the bank?
Good question. So that amount there, the 2.7, is what's in the bank. Opioid settlements will come to us in a lot of different increments. They're not monthly, they're not quarterly. When the Attorney General's office settled the lawsuits, they come periodically. So we have, I think, 5 or 6 different settlements that we're going to receive funds for over time. Some of them are once a year, some of them are twice a year, some of them are 4 times a year. So it was just easier, I think, for us. We do have this overview, and I put a few here on the table for the audience. It shows where kind of what we're anticipating every year through 2038. Although this does not include a very recent settlement that was finalized this week. They finalized the Purdue Pharma lawsuit this past week. They have not, we don't know what our allocation will be yet, other than the state of Washington's getting something to the tune of, I wrote 105 million. I think that is correct. So we haven't seen what Cowlitz County's share of that will be yet. So that will get added to what you see here.
Okay. Well, thank you. This new sheet here really clarifies it. So.
And it is available on our website. We update it probably every couple months when we receive additional funds.
I appreciate that. Just wanted to clear that up as an old business. Anybody have any questions on that?
Go ahead, Steve.
What are the options for that money? What are the limitations for what we can spend it on?
Sure. I think Gina had reviewed this a little bit previously with the commissioners, but not with the full Board of Health recently. So it can be used for treatment. So that would be, like medically assisted treatment. It can be connecting folks into treatment and recovery. It can be addressing the needs of pregnant or parenting women with substance use issues. It can be used for prevention, so preventing the overprescribing of opioids, the misuse of opioids, preventing deaths. And then it says other strategies like first responders, things like that. So and I know that Kelly, you had asked, there had been a kind of a casual request that we gotten by email. We don't have a decision on that yet from legal.
Thank you very much for that. Other questions? Okay, thank you very much, Carol, for touching on that. Which brings us to new business. So I'm just switch 2 things. I kind of miswrote it on the agenda. So I want to go with the county health priorities before the mission statement. And we had a couple board members want to talk about that. And sorry, my memory, I don't remember if it was Karen or Lorna. Karen, sorry to, did you want to talk about it? I don't mean to put you on the spot.
Nope, no problem at all.
Oh.
So, yeah, I think we've all kind of alluded to this, but I think it would be helpful if we outlined our priorities as we see them for the coming year, 5 years, don't care about the time frame, just so that we know what our focus needs to be. And I think this ties together really nicely when we talk about a mission statement, and then we talk about assessments that have been done in our area and the possibility of doing our own needs assessment, because I think that will help us focus what should our priorities be based on what does our county need, the populace, for their health. So I just want to start the discussion.
I appreciated the links that you sent in your email and Dr. Krager's email with regards to that topic as far as what are our county priorities and issues. And I'm glad that we're doing this because it's something that we just spent 30 minutes talking about in the previous meeting, and that is prioritizing resources and prioritizing our focus. What is our mission? What are we working towards? What exactly can we change and what can we influence? And let's not spend time on things that we can't influence and we have no control over. So I'm glad that we're doing this, and the information that Dr. Krager gave us in his email and that you provided in those links was very informative.
Lorna?
Yeah, I think it's a good discussion to have. I just, as a priority for me, I would love to see the mental health things that we spoke about in the previous meeting. I don't know what influence the Board of Health would have on that, or what I don't know. I don't know what piece we'd play in that, but having some sort of mental health facility in the county, I think is really paramount. I think that the mental health, behavioral health issues impact so much, so many things, both a quality of life and the financial pieces of the county. I think I would love to see a focus towards that.
And we'll talk further about that on the end of the agenda too. Dr. Krager, did you want to say some more? You had a very good email and I appreciate what you said. Maybe you can give us a little bit of your view, what kind of priorities we should have.
Thanks, Chairman Kelly, or Chairman Lane. This is, Steve Krager, Health Officer for Cowlitz County. Yeah, I mean, we've discussed a little bit over email, kind of, limitations on the Board of Health, what we can't do and what we can do. I generally, and I propose some ideas, but I do think, again, just based on some of my work that I see in other parts of the state, something called a community health assessment, which has been done in Cowlitz County, but I think the last one was 2017, if I'm correct. 2014, so even more than a decade ago. It is a good place to start. And to me, it's kind of like, I have my own priorities that I think are important. Everyone probably on this board does as well. Our community has priorities. To me, a community health assessment is a way to filter all of that, look at all the data, talk to, our community partners, do community surveys, do community, work groups, and try to distill that into what does the data say is most important? What does our community say is most important? And then there's usually a second part of that called a community health improvement plan, where we try to create strategies to address those things. And one thing I think is really important is, the local health department has a role in that, but it really is a community health improvement plan, whereas, the health department might be the convener, but it's trying to bring together all the resources in the community to address those issues. So, again, to summarize, I could, talk about my priorities, but I kind of want to have, a bigger picture process that helps us all distill that down.
Who provides those assessments?
Yeah, it's usually run by the health department, and I've seen it done in different ways. Usually there's like a steering committee, often, kind of based in the health department, but then they bring in other community partners. I've also seen other counties, and I'm trying to remember off the top of my head, really where they will contract out, to some, like local contractor, local business that does this type of work for businesses or maybe for other health departments, or they really drive the bulk of that work. So it kind of depends on what you all want and what resources, our department has.
I would say that I have a copy here of the 2014 Community Health Improvement Plan. And you say that comes after the assessment?
Yeah, assessment is kind of like data collection, right? We pull data from all these sources and try to organize it in a way that makes sense. And then the plan is kind of like, okay, we have all this data. What are the most important priorities? And then what's the strategy for how to try to improve them? Yeah.
So we should, everybody, I don't know if you probably haven't seen that then, the new commissioners. We should,
No.
Kelly, can we get a copy of this 2014 Community Health Improvement Plan sent to the board again? I've been through it and it was a lot of work that was done. I'm kind of thinking it didn't go anywhere. That's the worry that I have, is this is an expensive report that had a lot of work put into it. And then, well, for 11 years, I guess it's been kind of ignored. But on the other hand, the key findings is, and I'll just read it. I've read it before a couple of years ago, I think I said, but the county health priorities that they came up with are three. One, ensure healthy starts to life for all children. Improve healthy habits for residents of all ages. And three, increase opportunities for economic success.
So I guess I would ask, I don't know how they arrived at that. What data from where do you go out and gather to try and even put that assessment together?
It's a great question. There are actually kind of guidelines that most health departments use, usually from the National Association of City and County Health Departments or Health Organizations, NACCHO. And they kind of have, again, guidelines, and it kind of lists all of those different data sources. This is not my area of expertise. I've been involved in them, but from what I remember, it's, we have lots of different sources of data in terms of data collection. There are kind of national surveys that occur that hit people in Washington. We have local surveys. We have all sort of hospital data. We have all our public health data that we collect. And then, so a lot of it is accessible now, but it takes a lot of work to kind of pull that together, right? The other piece that I think is important is some of the community engagement part, which is where, I say we, but what I've seen in other places is, surveys sent out to the community, a lot of outreach trying to elicit feedback. What are your priorities? What are, from the citizens, where do you see barriers in health, or where can we improve? And then, part of that is working with various nonprofit, with business organizations, the same thing, and trying to elicit a feedback from them. So it's a lot of like static data sources that we kind of have access as well, but then a kind of community-driven way to elicit more data.
So to add on that, I'm just going to give you some examples of how some of these reports have been drawn together. This is the Peace Health Community Health Needs Assessment. And what they do, they conduct a thorough review of public reported data from national, state, and local sources to assess the community's needs. They also then convene community stakeholders from multiple sectors to review the data and provide feedback. And so theirs is about data collection analysis. The Lower Columbia College Head Start Community Assessment, they do it by combining quantitative data analysis with qualitative insights, which I think are needed for our community, because you can get all the quantitative data out there, and it still doesn't tell you how does it affect the personal experience. And I think that's where the qualitative piece really comes in. We want to know what our people are experiencing. And so that's another, it pulls it together. The Alice report is available. That this is a state report, and it talks about, Alice means, I always have to look up this acronym, as asset limited, income constrained, employed households. So that's what the Alice report is. So there are so many different reports out there, and I would love to see us convene however we think we need to, whether it be a strategic group to pull data together and look at all these different, and this is just a small sample of what's out there, and look at it for our perspective, so we get an idea of what does the data say about Cowlitz County, and what do the people of Cowlitz County say. From that, we can look at developing what we see as the community improvement plan, particularly from our perspective, from a health perspective. What can we do? And I agree, to have a plan just sit there on the shelf is worthless. That's wasted time, energy, and everything. So we want to have a plan that can drive our focus, can choose our priorities, and that's where we can put our money, our time, and our energy to make some positive improvements.
I'd come from a slightly different approach in that if we already have this one plan, I don't know that those priorities would change too much. I think that those three priorities, healthy starts for children, healthy habits for all residents, and increased opportunities for economic success, those are all nice, good ideals, and probably if there was some kind of entity that could do something like that, it could improve. But I'm wondering if doing another one would be much different, number one. My second thought would be, Dr. Krager, since you're with a few different other counties, could you maybe find out their reports, and could we take a look? I'm sure that different counties will not be exactly the same as us, but maybe there's should be a lot of overlap. I mean, people are people.
Yeah, it's a good point. I think one of the benefits that I have in working for other counties is that I will say that each county is unique. They do have unique challenges. Certainly, like, yeah, health kind of public health issues are often similar, but there's also always little nuances. People have different access to healthcare. There's geographic issues. There's, differences in income. There's all sorts of kind of nuances in a population that, Cowlitz is a unique place. I think that's just true. That's true for each county that I work for. So, one idea that I had when I was thinking about this a little bit is we have that community health needs assessment from Peace Health, and that's something that they're required to do by law, and so they do it, I think, every 3 years. We could focus on data that we don't have to focus on the data that they have already collected. We can do our own priorities too and make it a little bit more limited since they've already done a lot of work around that. That was one thought that I had. But I can certainly send out, let's see, I know Walla Walla has recently completed their community health assessment. I wasn't a part of it because I just joined them recently. Benton Franklin is currently starting the process, so I'm going to be a part of that, so I can kind of also give you a report of kind of what it looks like from the beginning. Let's see, Mason County, I'll have to think about where they're at in theirs because I can't remember off the top of my head. But there are lots of other examples, and I sent you Wahkiakum's just as like a local one. They're a small community, so they don't have the same level of data, but they had a really nice process where they brought in a lot of community stakeholders and citizens, and I don't think it was a ton of work, but it was work, and I do appreciate both of your points about, what we do with a plan, right? Like if you just let it sit there, yeah, what's the point? So what I would hope from whatever is produced is that we have some concrete steps, right? We say make some concrete directions. Maybe it's spending money, maybe it's just creating a group that has some specific tasks and goals that they're going to work towards. And then, you all kind of monitor that or something. There's lots of different ways to approach it. So anyway, those are a few of my thoughts on the matter.
I think that that's a good place to start. If we can get the one from Walla Walla and any others combined with the one from 2014, plus the Peace Health one that's just released, and then even the federal report that has just been released too, at least the board will have some reading material to think about. But I agree with Dr. Krager. You gotta get all this information. You do have to kind of come up with something to do if it's government's role to do that.
Well, and I'm somewhat cynical about things like this only because, for example, what quote rephrasing here, but creating healthy habits or whatever number 2 was. I don't think that it's any mystery that bad habits are not healthy for us. Yet there's a line at the drive-thru at McDonald's. People vape, people smoke, people drink. I knew I should have woke up this morning and worked out, but I chose to sleep an extra half hour, right? So there's the agency that's involved with people is where I sometimes wonder, are we being effective in spending time, energy, and resources in those types of things? Because they're going to do what they're going to do. Like I said, everybody knows that those things are unhealthy for you, and yet everybody still does them, right? And so to me personally, spending time and energy on those types of things, I feel would be not a good use of our time or resources, only because they're still going to do what they're going to do. I would rather see us focus on things that we have influence over, that we would be able to say and identify, this is what we want to accomplish, and know that we can get there. I'm not saying that I'm against, but look at all the programs the government started. Dare to Keep Kids Off of Drugs. You could just go down a litany of programs, and yet we still have a ton of unhealthy people who are obese and eat unhealthy. I'm one of them. I just had pizza yesterday, right? So those are the types of things that I don't know that are good for us to spend our time and energy on. Personally, I think that we need to focus on areas that we can actually have influence over, if that's what we're going to choose to do.
I agree, but I'd also like to add this perspective on that. Healthy habits, right, and encouraging healthy habits, we can't control individual behavior, but we can set people up toward success. So, for example, having the lovely walking path around Lake Sacagawea, lovely. That, to me, is promoting healthy habits, because it gives people that opportunity to go out there and walk in a beautiful place. Even the walking trail in Castle Rock, same thing. So having activities that people can participate in, readily available. Having healthy food choices readily available. Part of the problem, particularly if you look at the low income and healthy habits. So if you look at what they eat, it's not the healthiest choices. Not because maybe that's what they choose, maybe it's because that's what they have available. So that's where, again, community gardens are wonderful, because then you have options for healthier choices. So though we can't change people's habits, we can set up good choices.
I can see that.
Well,
But, but I will say that, I know people who are struggling financially and they still go to fast food restaurants, and that's much more expensive than just going grocery shopping and cooking for yourself. I do agree with you. The walking path, I had never looked at it from that perspective, so thank you. You did enlighten me there. So those types of things I can see that we can have influence over, but ultimately they still got to get into the car, drive down to the walking path, get out and start walking.
Yeah, having the facilities is great, but how many people can you drag to the path? One of the things that strikes me of the 2014 report is those three focus items are so generic. It sounds like a nationwide, oh, by the way, let's be healthy type of a comment. There's no specific focus on Cowlitz County. And it sounds to me like national surveys and everything took over looking at Cowlitz County, and we put such a generic plan together that there was no way to make it work. And then it went on the shelf and we said, hey, we did this pretty little thing. Here's this, look at how wonderful this is. And it's got these three generic goals, but they're worthless. And we can get the paintbrush out and put rainbows on the damn wall, but it doesn't make it better for anybody. So, if we're gonna do another study or put stuff together, I'd like to see it focused on Cowlitz County and make it something that if we come out with goals, how do we achieve those goals? What are the steps to get there? And what can this board actually do to promote those steps? So if we can put together a plan that actually has specific steps to reach a specific goal, I'm all for it. But if we're just going to produce another report that's going to collect dust, I don't want to see us waste the money.
And that's why I kind of think it would be good just to kind of start with, first thing, make sure everybody on the board has a copy of this. You can go
Okay.
through it, see yourself. Then if we can add to it with some from other counties, from Dr. Krager, plus Peace Health, at least the board we'll all kind of at least be on the same page of being able to have read what's in there
Right.
and what the possibilities are. But my personal belief, to throw it in, I guess, is that the government should not be telling people how to live a healthy life, that the government should protect the liberties and rights of the people first. And I kind of, this is not well worded, but the right to pursuit of happiness is actually above public health, in my opinion. And I will say it this way, that if any doctor, I'm sure Dr. Krager would say that cliff diving and jumping off of parachute towers, stuff like that, is probably not the best health choice, but people make it. So I would like to give this person who wants to jump off cliffs his right to pursue his happiness. If he dies doing it, well, it was his risk that he knew that he was going to take. On the other hand, some people, and this may sound a little crass, but some people get happiness from a bag of Doritos. And I don't want to take that away from them because it's their right. I do, on the other hand, so I'm contradicting myself. On the other hand, yes, there are certain things. We have things like a path in the city, a beautiful park that should be promoted and that could work towards promoting some better health for some people. But it's a real fine line. I don't see where government's going to be able to help a lot. But on some of those points, yeah, I think that we can make some efforts. And that's just, again, that's my opinion. The government shouldn't be doing it. It should be between the patient and the doctors themselves individually to choose their own healthy paths in life. Because they're all different, right?
Absolutely. One thing I would, if I may,
Please.
I will the only caveat I would add is that, and this is it's honestly like a perfect kind of philosophical discussion about public health and its role. But the only thing I would add is that there are sometimes individual choices do impact the greater community, right? And so that's why we have things like speed limits. But balancing that, right? Like when does someone's individual right to do something then impact enough people that it's worth restricting, right? I think that's kind of the crux of the issue. And I generally agree we can't make people do things, but I really appreciate what Karen said. We can kind of nudge them towards correct, easier choices. If, maybe not everyone lives next to the lake and can easily walk around it, but if we have more parks nearby them that are easily accessible, that makes things a little bit easier, right? If they can just walk a few minutes to get there. So those are the kind of things that I think about. Yeah. And I didn't mean to cut you off.
Yeah, no, I think that's really good. You have something to talk about on the priority committee, county
I
health?
do. I
priority?
want to
Please.
make some suggestions. I think what I think our priorities are trust after 2020 and the COVID fiasco and debacle and fraud and everything else has reduced trust in the medical community to such a high degree that I think that's a priority, is reestablishing boundaries that are actually make sense and actually follow the real science, not whatever dictates somebody comes up with that's just bogus, like 6-foot distancing or whatever, actually following research. The other is, what are the implications of access to actual primary care here and the affordability of it and people's access to primary care when they can't afford it much. And the other is essentially mental health. A lot of bad habits are because people are either depressed, stressed, or a lot of situations and may not have any access to counseling or having a way to resolve those issues. So those are the three things that I think are very high, but trust is really big. I won't go to a hospital anymore. Not after what I've seen.
Yeah, that would be a good priority,
And I used to work in them
to
35 years.
regaining trust, public trust. That would be a good priority too.
Yeah, if we figure out how to do that.
May-
I, I want to quickly respond to something that you said, that speed limits. And I think that's maybe a fair comparison to the problem. Speed limits don't help a damn thing if you don't enforce them. Okay, and it's the same problem you have with health. You can put up all kinds of signs and you can put up all kinds of great information and you can provide all the paths in the world for people to walk. But if you can't get them to do it, okay, and in the case of health, what power of enforcement do we have? Speed limits, you could put all the cops in the world on the street, which they're not doing to enforce them. When I drive around Lake Sacagawea, which is now 25 miles an hour, I can't tell you how fast between my street, Florida Street, and getting to Ocean Beach Highway, how fast I stack up cars behind me doing 25. I'm doing 25. They weren't doing 25. When I pulled out, there was nobody behind me. And by the time I drive that 3/4 of a mile, I got half a dozen cars behind me. Sometimes the guy behind me flashing his lights and honking his horn because I'm doing 25. And I just ignore them, but there's no enforcement going on. Okay? Now that's a speed limit comparison, but I don't know how you enforce good health. How do you force somebody not to eat the Doritos? How you gonna go close down McDonald's? I don't think so. Okay, so all of those fast food restaurants and everything have become a convenience of society these days. And maybe you can make a list and say, well, this restaurant serves healthier hamburgers than this restaurant does. But I don't know if you want to get into that type of a scenario. You probably have lawsuits coming out your ears. So I don't know how you make enforcement work, and all you can do is put good information out there. And I would be all in favor of if you could get into the schools at a younger age and get people to understand good health habits. But the schools, what was it, Michelle Obama did? Helped us get pizza in as a healthy food for lunch for kids because it has tomato sauce on the damn pizza. What? Wait a second. You're just talking about a healthy diet. We're serving pizza to kids in school. Where does that take them in a few years when they graduate? They learn the fast food habit just like everybody else does. And it's so easy. I mean, I've got a different metabolism than other people. I guess I'm blessed with the fact that I can eat a lot of food and it goes through me pretty quick, and I don't gain a lot of weight. But I've got the same habits. I do a lot of fast food restaurants because I don't want to run home and make a sandwich and make a bowl of soup. So I don't know. The enforcement part stuns me that the speed limits comparison, you can enforce a speed limit.
Yeah, it's a really good point. You know, I'm not a huge fan of enforcement in general. I just, you know, I think it often drives kind of resentment, at least around health. So, I will just go back to, yeah, at least providing options and making it easier for people. One thing I've seen in other communities is like, you know, farmers markets and providing vouchers, right? So then you're supporting local farms. And then, you know, if it's, you know, low cost or free, some people might make that choice. Is that going to make a huge difference across the community? Probably not, but it might help a little bit. It might help a few families buy some healthier food. So maybe, you know, enough of those stacked together can make a difference.
I like what you said, make it easier for people.
Yeah.
It's true. That could be a possibility we could do. See?
So, great discussion. I really appreciate all the discussion, and I agree, you cannot enforce health as a healthcare provider in the past. I can't make my patients choose the healthy things, but I can advise them and hopefully make it easier for them. One of the things that was mentioned by the member of the public that mentioned trust, he also mentioned access and affordability to primary care. Yes, because we can't enforce people and make them go to their primary care provider, but having access is opening the door. And I think that's really important that we open the doors for them. The same with mental health, is that access be provided. So I would agree. May I suggest that one of the things we might start with as a way to move this forward is to just summarize key findings of several local reports. If we just have key finding, right? And then we can look at all those and see where the commonalities are or aren't. And then it can at least guide our priorities without having to do another report, if whatever we choose to do, but that might be one step forward.
I think that's a good, we'll start with what we have and what Dr. Krager has. Get us all, give some reading time and something to bring home and put you to sleep if you have insomnia, some of them. And that's good. So I'd like to move into the next business, which would be talking about a possible mission statement. Karen, again, would you like to talk about that?
Gosh, I think I'm owning the mic today. Sorry about this. So when I became a member of this Board of Health, one of the things I always look for is, what are my duties? What's the mission? And I could not find that we had a mission statement for the BOCC Board of Health. I could find the RCWs and a list of our key responsibilities. But what I'd like to see us do is just develop a simple statement. So anybody that's looking and saying, what do you guys do? They have a simple way to find it. For example, Washington State Departments of Health's mission statement is, the Department of Health works with others to protect and improve the health of all people in Washington State. Cowlitz County Health and Human Services, our mission is to protect and enhance the environments in which we live, learn, work, and play through partnerships, prevention, and education. I understand, because I've been through the process of writing very many mission vision, value statements. It can be long and arduous, and I would just like to take some of the work out by proposing a simple mission statement that kind of draws everything together. And I just would propose the Cowlitz County Board of Health sets policy and provides oversight in matters that affect the quality of life and health of Cowlitz County residents. This could be posted on our website so people can get an idea quickly of what we do without having to go through the WACs or the RCW, sorry, and key responsibilities. And it might help us focus our efforts. Open to comments.
Could you read that one more time?
Yeah.
I would be happy to. And this comes from some of our key responsibilities in RCWs. So the Cowlitz County Board of Health sets policy and provides oversight in matters that affect the quality of life and health of Cowlitz County residents.
That's not bad. Well, that's not bad at all. I did speak to the lawyers about a mission statement, and generally boards don't have mission statements, but they are included in the bylaws under a purpose, or in ours, it's under powers and duties. And so I was thinking about what you said, and so the powers and duties of our Board of Health, to me, powers and duties equals or equates to a mission. But these come straight from the RCW, and well, just can you read them? I'd like to just have Kelly read the what it says now, but I can already tell you that yours is nice and simple and much more cut, right to the point.
The Cowlitz County Board of Health shall have supervision over all matters pertaining to the preservation of the life and health of the people within its jurisdiction, and shall enforce through their local health officer or the administrative officer appointed under RCW 70.05.040, if any, the public health statutes and the state of the rules promulgated by the State Board of Health and the Secretary of Health. Supervise the maintenance of all health and sanitary measures for the protection of the public health within its jurisdiction, and act such local rules and regulations as are necessary in order to preserve, promote, and improve the public health, and provide for the enforcement thereof. Provide for the control and prevention of any dangerous, contagious, or infectious disease within the jurisdiction of the local health department. Provide for the prevention, control, and abatement of nuisances detrimental to the public health. Make such reports to the State Board of Health through the local health officer or the administration officer as the State Board of Health may require, and establish fees for issuing or renewing licenses or permits, or for such other services as are authorized by the law and the rules of the State Board of Health, provided that such fees for services shall not exceed the actual cost of providing any such services.
Is your mic on?
So,
Yeah, hit me.
I could hear you
Yeah.
barely.
so that's a big, long one that is in both the RCW and our bylaws. If we wanted to add another mission statement somewhere else, like you say, on the Board of Health website, something like that.
Well, I just interpreted it as what Karen just read would be our mission statement, and that's how we're gonna enforce or enact our mission statement based on doing those things. So I kind of viewed it as two different things after Kelly read it. That's more of, this is what we're going to do, this is our goal, and how we're going to do it is over there.
Yeah, that's fair. Do you want to make a motion, or do you want to do you want to vote on a mission statement today, or do you want to, you have your wording perfect and the way you want it?
I put it out there. I think it is pretty good. It also follows the RCW very closely. which I'm going to read just for the record. RCW 70.05.060, powers and duties of local Board of Health. Each local Board of Health shall have supervision over all matters pertaining to the preservation of the life and health of the people within its jurisdiction and shall da, 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 da. So I would entertain a motion that we accept this mission statement as presented.
So Karen would like to make a motion that the new mission statement be adopted, and you want to read it one more time so we have it?
Certainly. The Cowlitz County Board of Health sets policy and provides oversight in matters that affect the quality of life and health of Cowlitz County residents.
Okay, anybody want to amend that or edit it or think about it or?
I'm good with it.
Would this replace what Kelly read?
No,
In
No.
addition to?
in addition.
Yeah.
Good with that.
Okay, well, we've got a motion on the floor to accept the new mission statement as read by Karen Joyner. All in favor of this new mission statement, say aye.
Aye.
Aye. Any opposed? No opposed. Okay, passes, and we'll just have to figure out where we can put it. But it sounds good. Yeah, maybe we could change the purpose. Okay. Yeah, maybe we'll cut down some, hey, I like that, cutting down stuff off the website so we can take this and change it to a couple sentences. Sure, what is that purpose? Is that in the bylaws or the RCW? On the website, okay. I see, yeah, the board ensures orderly growth, prevents illogical extensions of services, and protects the interest of local communities. When did that, I haven't seen that one myself. Carol knows about that.
I think I had pointed out something recently that was copied and pasted from the Board of Equalization page. So I think that may need to be adjusted.
So would that sound good to you, Karen, to replace that purpose? Oh, there we go. So now we
I
got,
think that would be wonderful. Instead of that purpose that we just really doesn't fit us, that we replace that with mission statement.
excellent. So
Yeah.
yeah, all right, well, so we voted on it and now we know where it's gonna go and, okay, that sounds good. Thank you for that. All right, in the interest of time, we'll keep moving on. Health assessments, we've already kind of talked a little bit about them. But there was the new health assessment report from Peace Health. And one of you wanted to bring up the points on that?
Sure, I'll speak to that. They are required to do this. I think it's every 3 years they have to do a community assessment. And this is community health needs assessment put together by Peace Health. And this is for our local area because St. John Medical Center does this. And what I want to just mention is the key findings. And in the interest of time, I'm just going to do my own summary of these. Access to resources for food insecure houses, significant need for all types of housing, need for support navigating social service resources. And my own ad lib on this is we have a lot of resources available. Navigating them is difficult. Next is substance use disorder treatment and access to co-occurring behavioral health services and resources to address the needs of households living in poverty. And specifically, it mentions some Black, Indigenous, and people of color. And community members are experiencing social isolation. So those were their key findings. If I may, I'm just going to move right on to Lower Columbia College Head Start, Early Head Start, and ECAP. They also have to do a community assessment and their 2025 update. And their key findings. Let's see. I really liked, and what they also gave was 2 pages of community strengths, which I thought was really a nice thing to add to these reports. And then it talked about community needs. You know, basically, there's a list, but culturally responsive services, infant and toddler care capacity. Again, this one is going to focus more on early starts, right? Early learning, workforce expansion, housing insecurity, single parent family support, early childhood coordination. That were those ones. And then the Alice report, which is from the state, it just gives some nice, not nice, some ugly trends that are still going on in Washington. That between 2010 and 2023, total number of households living in Washington increased by 19%, in poverty increased by 4%, and the number of Alice households increased by 65%. So we're still looking at financial issues. So the other thing that I saw was the 2018 Washington State Health Assessment Report Summary. This is a summary of findings relevant to Cowlitz County. So I thought that was pretty interesting, and it talked about the OH's top priority health issues: child immunization, diabetes, drug and alcohol abuse, healthcare access, healthy weight, housing and homelessness, mental health, and tobacco use.
That's a good summary. Thank you. Yeah, what stuck out to me on this Peace Health report was that I don't agree with some of it. Some of the information I found is, well, based on demographics, is not correct in that report. I don't know what happened there, but I pulled some other demographics. We don't need to talk about that, but what they did say is that the main key findings was that there's a significant need for affordable housing. To me, that's kind of a funny statement coming from a hospital, but I understand it. And they also say that there's not enough access to healthy food. And that one, I have trouble believing that people are not having access to food when there is free food distribution every single day of the week for people that don't have the money. There's lots of these different places that are giving away food. So I'm not sure. On the other hand, a drug addicted family with some kids at home and the parents are doing drugs instead of cooking dinner, oh yeah, the kid's gonna be hungry, and that's a shame and terrible. But I'm not so sure if it's a problem of lack of food in our county, where everything else is saying that we're obese and we have too much food. I will applaud Peace Health, though. They did mention the mental health needs of our community, especially children, continues to be higher each year. So I like what they say there. Now I want to bring up another assessment that just recently was published, and I'm not going to talk about the whole thing, but this is from RFK and the federal government, and they don't mention housing at all. They are talking about the main 5 contributors to these problems, and the problems, I will say, are cited as autism, obesity or diabetes, ADD, and chronic conditions. And they are reporting that most of the things that are contributing to these problems are unhealthy food, preservatives, dyes, artificial sweeteners, pesticides, lack of exercise, and excessive radiation exposure. That's the kids getting the stupid cell phones in their face all the time. Chronic stress and over-medicalization. So these are 2 reports from 2 big organizations, and they really say some different things. But the things that I would like to point out is that, and this comes from the RFK's report together with one of our own local doctors. And they say that in 1968, approximately around 1968, 1 in 10,000 people had autism. Today, it's 1 in 30. 3% of the population was diabetic or obese. Today, it's over 60%. ADD was rare. Today, it's 8% of girls and 14.5% of boys. So when I read that, my first question, I guess, to you, Dr. Krager, is that true? And is that what we're seeing in our county?
That would be a great question for our community health assessment. No, because I don't have the numbers off the top of my head. But generally, those numbers feel correct for the U.S. as a whole.
Wow.
There's been, and I think it depends on kind of the data source you look at. We'll have to talk about caveats a lot because it's interesting when you look at this data. A lot of it is, obviously very concerning. I think and this speaks maybe to a little bit of over medicalization. Some of this is driven by us being better at diagnosing things and so catching more. And I think, maybe not all of autism spectrum disorder diagnoses is driven by this, but there's been some interesting research, and I think a good chunk of the reason why autism diagnoses have grown is just that we've become better at recognizing it. I'm not saying that's all it is, but I think that's a good chunk of it. Similarly with ADD and ADHD is, I think sometimes we've become better at diagnosing. And again, I think there's some interesting work to be done of, are we doing that too much? Are we overdiagnosing? Are kids taking too many medications when they shouldn't? But I do think that drives some of that. Obesity and diabetes would be really interesting to look at locally because I have not looked at that data for a little while, but it certainly has increased. Some of that is better diagnosis. Some of that is us living longer in general. Just as you age, you're more likely to gain weight and you're also more likely to have diabetes. But we also have significant problems with obesity, and that is multifactorial. But yeah, I'd be very curious.
60%. That 60% is a
Well,
lot. Well,
I don't think
the-
it's 60%. I think if you look at the data nationwide, I think it's around 30%
That-
obese and about 30% overweight. Yeah.
That sounded more like I thought.
Yeah.
But when I read this, it says 60%. That's a lot.
And we've made some progress, not necessarily progress, but we've at least flattened. Whereas, our rates of obesity as a country had been growing quite a bit. And if you look at the last few years, this at least has kind of flattened off. Yeah.
I might add too that the medical definition of obese is 20% over ideal body weight. So when we
20%?
Yeah, so when you see the word obese, sometimes we think more of the morbidly obese, whereas if you're just 20% over your ideal body weight, you can medically be classified as obese. So it depends on how the studies are looking at it.
Oh, we could just change the definition, then we'd all lose weight.
Well, if you.
We'd all be
even
less obese.
Just working out too, gaining muscle mass would
Yes.
throw you in that category.
That's right, too.
But one thing that I find interesting in all of this is diabetes, obesity, the things that we're talking about, enforcement. Usually it takes an outside factor, and the enforcement is a byproduct of our own decisions. I'll give you an example. I went to the doctor 2 years ago, and my A1C was 10.5, and my blood sugar was almost 300. I haven't had a soda pop since then. So unfortunately, as human beings, being the creatures that we are, it takes, you use the word nudging, it takes a shove in the back unexpectedly to change our habits and to change what we do on a daily basis and what we consume. There were a ton of healthy food options for me prior to that. I just never went there for a lot of reasons, not just because it was convenient, but mainly because I didn't have time to make a meal when I'm on the go all the time, and it was convenient. The price of the food didn't really matter to me at the time, because it was, I just got to eat because I've got to be somewhere. So our lifestyles also play a huge role into our decision-making and how we factor in what we eat on a daily basis that contributes to the diabetes and the obesity and to the things that we're talking about. But in my mind, what this all boils down to, and Dr. Krieger, you said this, and Karen, you summarized it, is I view our role as just providing options to people, being able to provide them healthier options so that they can choose. They may not choose that option today, but eventually a doctor visit or two later on down the road, they're probably going to have to. The choice will be made for them, or, they're going to graduate. But nonetheless, I look at one of our major roles after today's conversation is really just being able to provide options to people, and then they're going to choose what they're going to choose.
Yep. Is there, sorry. No. Okay, anything further on those assessments? Just wanted to bring them up, and I have a note here that I wrote that says that one of our duties, or one of our jobs as Board of Health, is to provide the public with the best available science, including differing viewpoints, so the citizen and his or her doctor can choose their best path. So Board of Health, we can't make people healthy, but I do like that you can nudge, you can steer, and offer, I think just the pathway, although there's not a lot of people, not everybody can get to that pathway, but maybe have her just put a picture up there and say, hey, everybody go out for a walk. If I think if a doctor says that enough times to you, or anybody says it enough time, maybe there'll be some kind of influence pushing you to do something good. Okay, so then I go to the last thing, but I see that the people have already left, and I heard before the meeting that you guys were already talking about the mental health facility that has been proposed. All I wanted to do here was to see if the board wanted to take that up as a workshop, thank you, workshop. Is that something the board wants to look further into? I'm looking at,
The commissioners are looking
Yeah,
at.
I was gonna say,
I-
would that be better addressed at the commissioners level, like have a workshop at that level versus our level?
it was
Just a-
Rick's suggestion. Rick told me to bring that up, that the Board of Health would open up a workshop, because it includes the BOCC, and the workshop can start looking into feasibility of doing something.
Options.
Yeah,
I'm not opposed to it.
yeah, I'm open to it. Yeah.
I don't know that I'm not one to have meetings just to have meetings,
Yeah.
but I'm not opposed to that, because I think it does fall under the purview of what we're talking about right now.
Yeah, I think it does come under the Board of Health, and I think if they've already given the presentation and I've read through it, but to workshop it through, maybe with the doctor as well, helping us through that. I've heard it so much brought up, and then again, before the meeting, I heard it being talked about again. So I kind of think that at least we put something official, that they had a whole meeting dedicated to just one subject. Yeah, is that I'm getting some head
I'm fine with
nods?
that.
Yeah, okay, well, so then I'll go ahead and make the next meeting, I guess, will be a workshop to discuss what did they call it?
Mental health.
Behavioral health, Cowlitz County Roadmap, or some kind of mental health, behavioral health.
Is there a chance, Kelly, that I hate to wait another month to discuss it again? Like, is there,
call an earlier one?
Yeah, I don't know what people's schedules are like, and I don't want to have a meeting just to have a meeting either, but I feel like there's a little bit of momentum and you've had a number of people here talking about it. If we wait another month, I don't want it to sort of, fizzle. So
Yeah.
is there a chance that it can be sooner, or I don't know how those scheduling those things work.
I'm okay with that. I'd say we'll take it offline and we'll work with the clerk to see everybody's schedule and see if we can find one. I know it's tough to find the place for the not place, but the time for the meeting. But yeah, going earlier is not a bad
Yeah.
idea at all.
I would maybe suggest if it worked for people to have it maybe like right after one of the regular BOCCs, because that tends to be when people come and having another day to come into town, another day for a meeting sometimes is tricky. So if that works for people, that,
So maybe we can find a light day on the BOCC day.
Well, some of the earlier comments, Larry Crosby specifically said, basically he's expecting a response every week. So
That's the pressure that I was feeling a little bit, and that's why when I was speaking to Commissioner Dahl, he said maybe we should put it a Board of Health workshop. And so earlier, I like that idea too, if possible. So let's summarize it as that we will set up a workshop for the Larry's project. I don't want to call it Larry's project, a mental health facility concept, as soon as possible. And if worse comes to worse, if we can't go, we'll do it at the next Board of Health meeting.
Kelly, another thing, the document that he handed out, I think, to the three commissioners. Is there a chance that can be forwarded to the whole board so everybody's kind of starting at the same page? I don't know.
Yeah, absolutely. That should be too. That's the Behavioral Health Cowlitz County Roadmap. Can you send that out to everybody? Thank you. Sorry for putting a lot on you. Okay, we're gonna have a lot of reading. Carol.
If I may, in August for the Board of Health, no, July, sorry, I'm jumping a month ahead. For the July Board of Health meeting, HHS would like to have about 10 or 15 minutes for the board to approve our 2026 fee schedule, because we have to start billing establishments right after that.
Okay. Fee schedule. That's not the winter budget, right? This is a fee schedule. Okay. Okay, yeah, we can do that. And you say it won't take too long?
Shouldn't, but can't guarantee anything.
Okay, we'll put that on the board, on the agenda.
And just for the record, I will not be able to attend the July meeting. I will be
Oh.
out of town.
There you go. See, now we better do it tomorrow. What is everybody doing tomorrow? Okay, well, let's come back and we'll pick a date and I'll work hard to get as many people as we can for a workshop. Anything else? Anybody have any further comments, public comments? No? Okay, well, thank you all for the great discussion today. And we will adjourn this meeting now at 11:08. Thank you very much for everybody.